Welcome back to American Medicine Today. Now, we've been discussing for years that Dr. Bonati was the first in spine surgery to break away from those traditional type surgical approaches, those highly invasive spine surgeries, and he transitioned it into his patented procedures, which are exclusive, and they are the basis for what's known as minimally invasive. But there's still a vast difference from what you do in comparison to what others call minimally invasive. One of those points being laser. You were the one that garnered FDA approval for the YAG laser to be introduced into spine surgery. But that wasn't just the miracle tool, was it?
Well, laser is nothing more than an instrument.
Okay.
And the fact that you have that instrument doesn't mean that you're gonna do a procedure.
Sure.
You can use for the procedure, and it's specific for certain things.
Sure.
For example, if you want to remove some sort of a bone spur that is touching a nerve, you may use the laser.
Okay.
Or if you have a disc herniation, you may reduce the size of the herniation using the laser. Or if you have a bleeding, you may cauterize the bleeding using the laser. But that thing doesn't mean that you are going to use a laser and you're going to get better.
But I see all these commercials talking about the use of a laser and people using it in their name as a miracle treatment, and then they're trying to directly compare it with what you do. Can you explain the difference in what you do comparatively to what others claim they do?
Well, unfortunately, when you develop something and is effective and had a transition from the old type of medicine to the new type of medicine, and you use one tool that is allowing you to obtain better results, the people copy that.
Yes.
And then suddenly, with time, you know that the restrictions of the use depend on what are you applying for and what results you want to have.
Yes.
And that comes with experience. The people who really jump on this boat, they may not have the experience. And then they use the laser as a tool to attract patients or to practically create that aura that they want to give to you.
Yes.
Is you have a laser, so you're going to do a miracle. It's not true. You need to have the experience. You need to know when you need to use it and why you're going to use it. And sometimes
you don't use it at all. Yes. When the laser is used as the predominant tool by others that are out there, how long would you say the results last?
If you, for example, are going to use to do an ablation procedure, then probably is gonna burst the nerve, but the nerve is going to regenerate. In around 6 months, the thing is going to be back there.
Okay, and the patients would then still feel the same pain.
Well, it will be probably sometimes even worse because now you destroy that nerve, and then you don't only have a nerve that is not functioning. Now you have a burned nerve, and you develop a neuroma. And that neuroma is more painful than just the pain that you had before on the joint.
And at the Bonati Spine Institute, you treat people that have gone through these quote-unquote laser spine surgeries?
Well, it's very frequent that I receive people that they come with a diagnosis of a procedure performed in the same level that we are going to operate.
Sure.
And when we go to that area, we understand that nothing was done. For example, all the lamina is intact, all the facets are intact. What they did is an ablation, and that's it. They go and they talk about the disc herniation and a laminectomy and a foraminoplasty and the whole thing, and then you go, you never did that.
Right.
It's nothing done. The people use an instrument thinking that instrument is going to correct the problem, but is very temporary or not at all.
Over 65% of the patients that come to the Bonati Spine Institute come to you after they've received failed back and neck surgeries somewhere else.
Well, they are different type of problems. Sometimes it failed back surgeries because they were partially decompressed. Some other times they were not decompressed totally at all. Or other times they would use lasers and to correct a problem that you cannot correct just with a laser. and so on. The failback surgery depends of what was done and who did it.
When people are looking into spine surgery, they need to be careful of someone that just tries to jump on the bandwagon and is more or less a cheaper imitation, though they say imitation is a form of flattery, and you could pat yourself on the back that so many people are wanting to emulate what you do. But, I mean, there's a big difference in results.
Well, there are differences in results because we have a tremendous experience. We are dealing with the same procedure and performing this procedure for almost 40 years is an incredible experience in my life.
Correct.
And so I went through a lot of things that allowed me to really understand what is wrong.
Correct.
And when I see, for example, other individuals that they have very little experience, they kind of compete. Every patient taught me one new trick.
Correct.
And every patient told me something that the other one didn't tell me.
Right.
So that application of experience is a life experience. Despite that, you can have people that they are very good surgeons, and despite that you can be people that they are very good intentioned surgeons, they don't have the experience.
The ingenuity that you had, though, to see the fault with traditional spine surgery, and though it was the standard at the time, you changed the standard. You saw the fault with what they were traditionally doing. You were so disheartened, you almost left spine surgery. Then you found a totally different approach with great and repetitive results. There's a lot to be said for someone thinking outside the box. And there's so many doctors nowadays, they go spine surgery, it's only done this way, I have my blinders on, I can only perform fusions, and I follow A to Z. And you go, well, wait a minute, I know the mechanics of the body, and you are able to diagnose spine problems and many other issues that are being misdiagnosed by other doctors.
Well, I have training in arthroscopic surgery, and I came to the market when arthroscopic surgery practically didn't exist. I remember that we have a camera of this size to be able to look with a little needle scope inside of a joint and see almost nothing. Thanks to the technology of the space technology, the cameras change very fast and the fiber optics change very fast. And with that application in the industry, we were able to really discover another world. And I was in the front run for that one.
You were at Wake Forest University.
Yes, correct. And then what I was able to I experience is very unique in life. It's like the people who invest in Google and nobody knew what Google was, and then invest in Google and now they go, I'm a millionaire. Well, I'm a millionaire on experience because I was exposed early to that, and I was challenged enough that I create tools and develop the system. And I create a new industry.
You did.
Because if you look, I am the first individual in the world to put a scope on the shoulder.
Correct.
And when I did that, I developed more knowledge. And then I went from arthroscopic surgery on the knee to arthroscopic surgery on the shoulder. And when I changed
and the various
shoulder,
joints,
I started to think other joints. And then I went with the small instruments and other joints. At the very end, I went to the spine because I look and I say, it's a joint. I can do that. The trip in my life through medicine in this field is amazing and is extremely rewarding for me. Not only because the knowledge, but at the same time, the enormous experience that I was able to change spine surgery from a fearsome type of a procedure where the patients were recommended by the physicians, do not touch your spine till you cannot walk. And today is, hey, do it tomorrow.
You want to be careful of that. You want to make sure you really need the surgery before you just jump into it. Thank you so much for your contribution to medicine. And we'll see you again next week. Thanks for watching American Medicine Today.